Okay, good afternoon, everyone. It is now 2:30, time for us to begin again. So if you guys can hear me out in the halls, you can come back in. Today we have the wonderful opportunity to hear from our Weber County and Morgan County Health Department to give us a little bit of insight about how we can align community initiatives to address social determinants of health. So we thank the Weber Morgan County Health Department for sponsoring this lecture. I would like to announce next we'll have a talk by David Park, who is the Dean of the Utah College of Osteopathic Medicine down in southern Utah for Rocky Vista University. And if you can't make it to this lecture, that next lecture, then please make sure to make it to the booth and just see what they're all about. So without further ado, I'll turn the time over to the Weber Morgan Health Department. Thank you.
Yikes. Sorry, is that okay? Can everybody hear me? Good afternoon. Thank you for being here. I'm going to start off our conversation. We also have Angela Choberka and Brian Bennion who will be speaking today. But I'm going to be speaking first around our intergenerational poverty initiative. Again, my name is Melissa Freigang, and we've been working on this initiative for the past 3 years as a community, and so we're really excited to be here and share it with you today. So I'm going to be very, very quick. I'm only scratching the surface, and then we'll open it up for questions at the end of the 3 presentations. So intergenerational poverty is something that we're looking at the county level. Again, we've been looking at this for the past 3 years and really moving and aligning all of our work towards an income equality and intergenerational poverty. And so the question that arises is, what is intergenerational poverty? So intergenerational poverty is different than situational poverty. So a lot of times when we're talking poverty, people will interchange that those two things, and they think basically just low income. And essentially what we're looking at in terms of intergenerational poverty is that it's 2 successive generations of families in poverty. So children are born into poverty, and you can see the definition that we look at when we're talking about intergenerational poverty. So when we're looking at intergenerational poverty, we're not only looking at behaviors and the situation, things that help people remain in poverty. We're looking at really from an anthropological standpoint, we're looking at thoughts and patterns of behaviors and what is learned through that family structure and that way of living. And so when we look at this, we don't look at this from a negative or a positive standpoint. We just look at this as patterns. And we understand that this can be a culture. And so we're not asking people who are experiencing intergenerational poverty to change their culture. What we want to change is the artifacts that result from the patterns of behaviors. So in Weber County, 10% of the children that are in Weber County today are experiencing intergenerational poverty. 28% of our children are at risk of remaining in poverty. That means that their parents didn't grow up in poverty, but that they are at risk of remaining in poverty. So when we're trying to work on our intergenerational poverty initiative, we're trying to decrease that number, but you can see the statistics that we have a big issue in front of us because it looks like we're growing intergenerational poverty. So we're really working hard to break that cycle. So just some statistics if you're wanting to see what intergenerational poverty looks like related to the state and related to Weber County very specifically. So you can see these average annual wages that from the Department of Workforce Services. And then you can see the educational attainment. And we know that those are all related to income and poverty. So the way we're looking at this is really trying to combine and move from this idea of, okay, now we know what intergenerational poverty looks like. We understand what some of these issues are. How do we go from, if you're looking at a medical model, of a treatment-based to a prevention-based as it relates to poverty and as it relates very specifically to intergenerational poverty? So there is an interagency agreement that's creating the Prevention and Prosperity Center of Excellence, and the interagency agreement is between the Weber Morgan Health Department, Weber Human Services, and Weber County Commission. And the idea is really, again, to merge and really leverage all of the great work that's happening in terms of prevention. And when I say that, all prevention, Weber Morgan Health Department has a phenomenal prevention program, and so does Weber Human Services, and they're very complementary of each other, but they're in two different departments. But what happens when we put them together and work together hand in glove, as well as looking at income and poverty from a prevention standpoint? So when we look at intergenerational poverty, instead of saying, okay, we want people to make X amount of dollars, or we want adults to be at this income level, the community has come together and really said, we want to create an environment where children can exercise the power of self-determination. We think that's the root cause of poverty. So if a child wants to become an engineer, how do we help with the barriers that occur in terms of self-determination? So, for example, if a child is growing up in an environment and doesn't have early access to language, right, and they're not ready for school, right, we understand what those long-term impacts are, and so if we can mitigate those as early as possible, then we know that we can start breaking the cycle. We also are looking at this from Maslow's hierarchy of needs. I didn't put it up here because I know everybody in this room knows what that is. But when you're talking about poverty and poverty treatment programs, the funding that comes through the state assistance is really that treatment base. So it's really taking care of basic safety and food and housing. So those social support systems that are really coming through the federal government are based on those foundational pieces of Maslow's hierarchy of needs. But when we're looking at culture and children, what are the other universal needs of children? And we know that it's belonging, competency, and autonomy. So what we're doing in practice is really trying to have implementation that really takes these into account, because they are just as important as safety and security and the physiological needs. So after 3 years of work, we put a framework together, the community did, and this is what we're calling our self-determination framework. So it's at the very beginning stages, not a lot is defined, but it's definitely a step forward, and we're frontiering this. So the first quadrant that you see is health and well-being, and that's really defined by the Department of Workforce Services. They have data around 6-7 years of what our county looks like in 4 categories. So they define health and well-being by family economic security, education, early childhood, and health. So they have lots of indicators, and we can see our data in terms of Weber County, specifically with indicators of health and well-being. And any of you can access that information. It's on the Department of Workforce Services, jobs.utah.gov/IGP. So, and you can see all the counties in Utah. So we're pretty lucky to have that data and have the state provide us that data. The second quadrant is really this idea around systems, access and equity, and things that are really sort of this external barriers. So if you think about access, that can mean anything: access to role models, access to healthcare, access to information. And then the equity piece is really around policy and systems. And are we creating equity where children actually have access and equitable opportunities? And then the dignity piece is really around how do we create that sense of dignity and worthiness in children, and how do we create these environments that instill that? And then the resiliency piece is the resiliency skills. So how do we help children develop resiliency skills, because we know that trumps adverse childhood experiences. And so the work that we're doing is really looking at a trauma-informed approach, and it's a human-centered approach. So when we're looking at this, we're trying to turn the poverty work on its head and really look at this from a human-centered design. Whoops, let me go back one more. So the family resiliency on the outside piece, so the way we look at intergenerational poverty in Weber County is that we're taking a child-centric approach. But we know that we have to take a two-generational strategy when we're looking at children, because the home and the parental income levels and housing and some of these social determinants really influence child poverty and some of these root causes of remaining in poverty. And the community resiliency piece, that's really how we're looking at coming together as a community. We did a study in our 2017 strategic plan. We asked United Way's 211 to give us a list. We wanted to do an assessment of who's doing this work, and let's do an asset map and see if we can pull all these community members together. And we asked 211 to provide us information on who's doing intergenerational poverty work in Weber County alone. And we had 567 agencies listed. Right, so we still have 10% of our children in poverty and 28% at risk of remaining in poverty, and we have 567 agencies trying to do this work. That's the idea of the center, is to pool all of that, the resources and the intellectual knowledge and really that social capital together to make an impact, and that's that community resiliency model. We decided that we think it's really important to understand what the evidence is and understand where we are, and then actually take, action. So how do we start somewhere and then understand what's happening and then move forward? So we have pursued a grant application with the Department of Workforce Services, and we've called it the Integrated Community Action Now, or the ICANN grant. And what we're doing is we're onboarding up to 35 families. We're only at 13, and the interesting thing about that is that even though it seems like we're doing less because there's less families, when we started making this definition and looking at this, the household sizes were much, much greater when you're looking at intergenerational poverty families. For example, we have families that have parents who are still married, but they're separated, living under the same roof with their significant others. So when you're providing this employability skills training and these wraparound services, you're actually not only helping one adult, you're helping four. And then that 18-year-old child transitioning from high school into the workforce, as an example. So the numbers really start adding up. So we have 13 families, and we have 63 people that we're doing intensive resource integration around. So it can become pretty overwhelming and large. But the fun thing is that we're seeing some really great impacts. So the idea is that we are integrating evidence-based practice, and we're pretty rigorous in terms of how we're implementing that. And what we're doing is each agency that has these evidence-based best practices, they're coming to the table and actually participating. So it's not just one agency providing services to 13 families. It's 13 families that are receiving services from about 20 different agencies, including major agencies like the Ogden School District for academic achievement, and the YWCA, or the United Way of Northern Utah for after-school programs, or the Boys and Girls Clubs. So the idea is taking what we know that can help change the artifacts from these behaviors and providing these resiliency skills for children, say, in the schools, and providing mental health in the schools, and all of these barriers that we know of, if we can get them to the youth in their school settings and provide these after-school opportunities and provide these recreational opportunities, we know that that can really change and make an impact on children and on adults in turn. So the idea, we call them, when we sit down with families and the parents as well as the children, we really ask the question, what do I need? And we're calling these the wins. So they can be little wins and big wins, and really the whole methodology is around how do we get someone these little wins that lead to this growth mindset that actually ultimately result in these big wins. And so when we're looking at that, one of the things that we're really finding is that you may have a family that does not have a diagnosed mental diagnoses, but because they're living in these extreme conditions, they have high levels of stress, high levels of anxiety that really impact their behaviors. So we have a resource integration coach, for example, who is working with a family, and sometimes the mother comes to the door, and then sometimes she can't, right? And so, the idea is, how do we build that level of trust, and then how do we help that person? Because we don't believe that motivation is low. We don't believe in the myths of poverty, that people just want to sit on their couches or, take welfare. It's really difficult to live in poverty. We know that everybody wants to. It's just that they all have really mitigating circumstances that preclude them from doing that. And then, of course, increase access to resources and social capital, which is extremely important. So we also know, if you look at the map, we have this issue from a Weber County perspective, but we also are extremely fortunate to have really fantastic initiatives that are also occurring. And so we do partner with not only home navigators and other caseworkers and evidence-based programs, but we have larger initiatives that are also pulling all of these groups and this knowledge base together. And you can see, so we have Weber County, we have Ogden United Promise Neighborhood, Ogden Civic Action Network that Ryan, I think, spoke to you last year about, and he's also going to give you an update in his presentation. And then, of course, the Utah Alliance for the Determinants of Health. And they've chosen 2 zip codes for their initial, and Angela will speak more to that a little later. But the idea is that we have common families together that we need to be making sure to coordinate and align these initiatives so that we're not duplicative and that we're not siloed. And so that was the number one issue that we saw in terms of that community resiliency scale, is that we had a lot of really fantastic programs, but we weren't aligned working together as well as we could. And so that's our major initiative, as well as with the ICANN program. So with that, I will introduce or call up, or I think I broke the remote. I didn't. Good.
And is it just this one? Hi, I'm Angela Choberka, and I work at Intermountain Healthcare. And as Melissa mentioned, I'm representing the Alliance for Determinants of Health, which is a 3-year demonstration project that Intermountain is bringing to the community, to Weber County and also Washington County, looking at the select health Medicaid populations there and how we might look at the social determinants of health, or those things outside of the health system that might help to improve people's overall health outcomes, but also lower healthcare costs over time. So that's my short elevator speech about what the whole project is about, just in case I forget some parts of that later in the presentation. This is the model that we are actually using to talk about social determinants. We know there are many other models out there. This one is really around thinking about the primary and secondary determinants. As Melissa was mentioning, this is one way that we've all aligned in the initiative, is that all the different efforts have adopted this social determinants model that's the same. So we can speak the same language and talk about these things, and all of us in the community can understand what we're saying. So we really see interpersonal violence, food insecurity, utility needs, housing instability, and transportation as the primary determinants. I know, actually, I'm an educator in my past life, and I know if children are sitting in a classroom and they're feeling hungry and stressed and having things going on at home, maybe with their housing, that there is no way they can possibly focus on the lesson, the magical lesson that I've planned, right? So these are definitely things that are at the heart of some of the things that Melissa was mentioning around having children feel successful in school, but also adults as well. And there's the Maslow's hierarchy. Obviously, we do care about the secondary determinants as well, but we want to really focus in on those primary to make sure those things are covered before a person can move on to the others. As Melissa also mentioned, the things that we're really trying to address in this project are much like she was mentioning about equity issues, is that if you look at these statistics, these are not real zip codes, the numbers, but they're actually real data points from Utah. I'm sure all of you have heard before about this discrepancy in life expectancy. And in Utah, we're lucky in one aspect that 10 years is about as far as we have in those discrepancies. However, it's still not okay, right? We can't live with this statistic and know that one person living on the east side has a chance of living 10 years longer than someone living on the east. And then you can see this is not surprising if you're an educator as well or a social service provider, that levels of poverty and education often align with those things too. So I'm sure that you all have heard our mission at Intermountain is to help people live the healthiest lives possible. And this is really in alignment with that, in that we know from research that about 60% of our overall health outcomes are actually coming from our social and environmental factors and also individual behaviors, our healthy behaviors. We really, often hear people talk about access to health care as the issue, and we have some of the most wonderful health care there is in the world, but really only 10% of our overall health outcome come from that access, right? I don't know, you're kind of agreeing with me, right? So it's not surprising to you, and then obviously genetics play a part in that as well. So the objective of the whole project, as I mentioned before, was to improve health outcomes, reduce healthcare costs, and be a model for change by addressing social determinants of health. And there are many other health systems that are doing this similar work. We want to work together with the other initiatives that are already happening in the area to align the social services and care delivery, remove those silos, as we've mentioned a few times in this project, and really to use technology and data sharing. We have data, obviously, because we're an integrated health system from Select Health, around the Medicaid population and what kinds of usage they have of the emergency department, what kind of conditions they have. And we really want that data to drive and help us to focus in on how we can best serve those folks. So why these geographies? Well, one is these great partners that we have in Weber County and also in Washington County in the state. There's really great work happening all across the state, but we know that there's already great partners that are willing to come to the table to talk about working a little bit differently together in order to do this work. Also take a lot of their time and energy to talk about how we might work together rather than just focusing on their own work. Also, we obviously looked at areas where there was at least 2,000 Select Health Medicaid members because it is going to be a research project. We have chosen an outside independent national evaluator to help us tell the story about this work, what's working, what's maybe more challenging. Obviously, some policy issues that we want to talk about too with Medicaid and other kinds of health care funding. And also the criteria around, as we mentioned before, some of these disparities in each of these communities. As I mentioned before, the community readiness, of course, the structure of the behavioral health model that they have in both of these counties, they have the behavioral health carve-out for Medicaid, so that makes it a little bit easier for us to work through some of these issues. We do plan to scale the project as soon and as quickly as we can across our own system in the geography areas, but also in the population. So we do obviously care about all populations, but the Medicaid population is who we're focusing on for the research aspect as well. I think I've already said all these things. We have accountability. We also have opportunities at every level of government. As you know, the state has a lot to do with telling us how we can spend those Medicaid dollars, and also at the federal level. So we want to make sure we can tell some of those stories and really influence some of that and impact change. So the first thing that Intermountain actually did, I actually have only been working there about a year. I came from United Way of Northern Utah working on the Promised Neighborhood Initiative. One thing that I really admire about what they did with this project is they came and talked to all the partners in the community, much like the Weber County Intergenerational Poverty work, and also Weber Morgan Health Department and United Ways and government officials, et cetera, to say, if we're going to do this project here, how can we do it? What would be the best way to do it? And a lot of the things that we said, like I said, I was working for United Way at the time, was please don't duplicate things that are already happening. respect the work that's already going on. Make sure you listen and stay tuned to all those activities because we don't want to add burden or extra work to other people. And then I kind of teased that I told them all this information and then I applied for the job to do it. So another thing that Intermountain did is they had press conferences in both of the communities to announce the $12 million community contribution that will go to these two communities to help support some of the work that we may want to create or, to help address some of the needs for Select Health Medicaid members. As you all probably know, there's lots of complications sometimes with getting access for all people, but particular populations around if you're qualified for certain kinds of services. One example of a barrier that we've broken through recently is that obviously medical transportation is covered under Medicaid, but many of the providers in the community didn't know how to gain access to that, right? I mean, it's kind of complicated to figure out how you actually get access for people to that. So we're hoping also, we have a model, which I'm going to show you here in a minute. These are all the great partners. So we have many different partners in Washington County, as you can see above, Weber County, and then we have state-level partners, and then also some supporters that really care about the community and wanted to help support as well. So on the state level, you can see that we not only have, state representation, but we have United Way, which also covers the 211 platform, the Department of Human Services, Workforce Services, all these different partners at that level that want to help us work through this process at the state level. And then locally, as I mentioned before, we have the alignment with Weber County and Ogden CAN, Weber State University, the school districts, Ogden City, Midtown Community Health Center, and then intergenerational poverty as well. And those are the similar kinds of partners that we have in Washington County. This is actually another element of the project that Intermountain was able to support, is to actually sit down with some of the folks that are living in the two communities and do kind of ethnographic interviews with them and ask them about their life experience and have us learn from that experience rather than us sitting in a conference room trying to determine what we think might be best for people. So this is just one example. As you can imagine, many people that are facing challenges with the social determinants of health actually are facing more than one at a time or throughout their lives have these different challenges. So this is just an example of one person that are obviously on Medicaid, so they're unemployed and on disability due to mental health conditions. They run out of money on the 10th of the month, which for me would be quite stressful on my lifestyle. So I can imagine that that's a little bit challenging. Living in a motel for the last 5 years, has used illicit substances before, actually was removed from the home because there was a firearm present, didn't graduate from high school, using governmental support, and then also was placed in foster care when they were removed from home, but did have some support from a church and pastor. So throughout their lives, they've had these different impacts and these stressors. And I think something that's also really valuable from thinking about these things, as Melissa also explained, is that sometimes we put our own lens on maybe what we think or how we think people should be living. But I think from really getting in touch with folks that are living in these situations, we can ask some bigger questions around, we might say, okay, let's move them out of the motel. I bet that's really not a great place for them, which could be true. But also, if they run out of money on the 10th of the month, I'm thinking that there's also some maybe community network of some kind that they might have at that hotel or motel that might help them to kind of get through that. That's some other information that we found in the Neighborhood Pulse study, is that people are having very transactional kind of relationships where they don't often think or have the ability to think sort of long-term or think about the future. They're really living in the now. So they have lots of relationships in their lives where they maybe get a ride with somebody or they share a food, some food or things like that. And it really is challenging to stay qualified for benefits when you're living in poverty. All the forms and the ways you have to keep track of those things and keep appointments can become very challenging too. So this was really an effort, like I said, to think a little bit more outside of what we believe maybe people's lives should be like, but to get a glimpse of how they're living now. So the common things, you wouldn't be surprised because the data also shows us many of these things, but there's unidentified substance use and prevalent behavioral health conditions, multiple generations living together, experiencing unmet social needs. Housing instability is huge, and we hear that from the school district a lot too, around the mobility rates for students. And they have multiple unmet needs. And the very last one, uncoordinated social service and supports. So that's also something that we're working on as well. So the model that we're using is coming out of CMS is awareness, assistance, and alignment. So if you see over here on the far left for you, we have these different doorways. We really want to see this project as a no wrong door approach. So we're working closely with the local mental health authorities. Locally, that's Weber Human Services, and then also the Federally Qualified Health Center, which is Midtown, because we all share common folks that we're responsible for. Community-based organizations, Intermountain emergency departments and clinics, and also Select Health. So we can share data between 3 of those different doorways right now pretty easily if we have coordinated care. But then looping in the community-based organizations is going to be really important too. So we're screening for social determinants, which actually at Intermountain by 2020 we'll be doing at every doorway systematically, screening with a questionnaire that's basically 12 checkboxes that ask about different determinants and if you're having impact from them now or have in the last 12 months, and if you'd like help trying to get connected with some resources for that. And then we, in the Alliance Project, want to connect people that have high social determinants of health challenges and, with these chronic conditions or visiting the emergency department quite often, to a community health worker, which is a more lay position in the community that can help people navigate those services and help to create an individualized social care and treatment plan rather than just focusing on the medical. And we want to bring in a digital platform that will help all the community-based organizations to really share referrals, but also know what happens at the end of that, so closed-loop referral system. And like I said before, we really are hopeful that the community-based organizations like the food bank will find value in using this platform so that they can also even refer back to the medical care, the primary medical home, or back to other kinds of services. Many times people don't realize, for example, that Midtown has dental services, or realize that there's different kinds of services that you can get from several of these organizations that can help support you too. So this is where we're really seeing, like I said before in the project, we're focused on the Select Health Medicaid members, but we also really want to help to support the whole household. If that member is having challenges with food or utilities or housing instability, then the whole family is also, or the caregiver situation, they're also facing those things. We also, for the community, want to bring in this data sharing and digital platform tool. So the ICANN project and any other project that we're working with is also welcome to use this. They can use it for all of their own clients, but then also we will be tracking specifically the Select Health Medicaid population within that. And then for the community at large, we really want to help to build a more robust infrastructure around this referral engagement so we can really tell the story about how these services are needed, how these social service organizations are doing really great work, but lots of times they get bogged down in trying to figure out how to find additional funding or various kind of funding streams where they end up doing kind of sideline work, to really talk about what are the essential services that people really need versus what the institutions need. So very much like the ICANN project that way. And we do want to improve the integration of medical and behavioral health. So this is a commitment that we made from the very start, like I said, to work together. So on the right, you see kind of these circles of the Weber County and Ogden area. And then in Washington County, they also have an intergenerational poverty initiative there and people working on that. And then some other smaller initiatives that are happening too. So we really want to align with all those and use each other's resources to, back each other up rather than duplicate things. And now I think Brian is up.
Good afternoon. Thank you for being here. I appreciate the opportunity to come to this meeting, this conference, and be able to share what's happening in the public health arena. And appreciate being able to meet with the board regularly as an at-large member. I think it's a great partnership. They've given us an opportunity to talk about prevention and about public health, and make the community a little bit more aware of what's going on in the community. I'm grateful to be able to work with these two ladies. It's been a real pleasure, opportunity to combine our resources and think not only short term, like a lot of the grants are that we get, but to really think what this community could be if we put our resources together and could lift some of the individuals that are struggling in a thoughtful way, utilizing the resources that are available in a coordinated effort. And that's really what we're trying to do. So the last initiative we wanted to talk to you about is the Ogden CAN initiative. And that's been going on for 3 years. And if you look at this, this is a diagram of the local public health system. Okay, and it's really a community system, isn't it? When we're talking about public health, there's so many different agencies, businesses that impact the health of our community. Often, people just look to the health department, the local health department or the state health department to take care of our drinking water, the food inspections, the swimming pools, the wastewater, those sort of things, which are obviously all important. But there's so many other agencies that play a role in this, and just wanted to acknowledge that. But one of the things we do, and one of our missions at the health department, is to conduct regular community health assessments. And we do that about every 5 years. We completed our last one in about 2015, so we're just getting ready to update that. We're going to have that all digital. We're excited about that, having a dashboard, so it'll be a little easier to navigate and to learn about the various health indicators. Last time we looked at 45 health indicators. And, in Weber and Morgan counties, there's a lot of things we're doing really well. I mean, we are a healthy state, thank goodness. We're lucky. There are other states that have a number of problems, but as was mentioned in these presentations, it really does depend on where you live, and that's true even in Utah. Zip codes, where there's life expectancy as much as 10 years difference, and I think Melissa talked about that. So there's still some real challenges. And so as we gather that information, it's one thing to do an assessment. It's another thing, what are we going to do about it? And so we've developed a community health plan. And we were very fortunate that the Ogden CAN Civic Action Network was being developed at the same time, unbeknownst to us, as we were looking at, well, what do we do with this information and how can we get that out to the community and what should be our priorities with our limited resources? And Weber State was doing, I forget what they call it, a college compact initiative. I believe that's what they called it. And they're going well beyond what other universities are doing and really serving to be a role model of what can be done. And now other communities are really paying attention. I know we've had a chance, a number of us that are involved with this, to go to national meetings and talk about what's happening here in Ogden. But one of the key things was no agency can do this alone, and how can we work together? And the thought was, well, let's take 7 anchor institutions that aren't going to go anywhere in the next few years. And let's have them discuss this, and then let's add some other partners and discuss how we can move the needle in a certain area and develop a model that we could have other people participate in. So as you can see, The anchor institutions are the 7, Weber State University, and then it was Ogden City, because we're looking at a neighborhood in Ogden, hence the name Ogden Can. And then the Technical College, the Health Department, both hospitals, both Intermountain and Ogden Regional, and the Ogden School District. And this is the neighborhood, and I talked just a little bit about this last year, and it's a 10-block neighborhood from Washington to Harrison and about 30th to 20th, approximately. And it's interesting to look at this. So again, it does matter where you live, and there's some challenges here. If you look at this neighborhood, there's about 15,000 residents. A little over 15,000 residents, so that's about 17% of Ogden City. In that area, there's 30% poverty. Now, the state average is under 10. It's like, I think, 9.7. So about 3 times what the state average is. We've got 70% of those residents that are below living wage. And so we have 45% Hispanic, Latino from 15 different countries. And as I've mentioned, the life expectancy is about 10 years less. And there's about 34% owner-occupied, so there's a lot of rentals in that area. How do we help these individuals? How do we, because this area of Ogden has a rich heritage, lots of amazing stories. What can we do to improve the trends here? So we developed a 4-phase approach, and like I said, they're in 3 years. As a health department, we've been doing this too, as we developed our community health improvement plan. And part of that, you can see the initiatives: improve housing, educate communities, and promote health. And so we've been developing and building social capital and getting organized. It takes a while when you only meet once a month, and you've got to build around each other's schedules. But we've been very consistent at doing that. And then defining strategies and interventions. We've been working on that. We're now moving into phase 3, where we are finding funding, going after grants. The anchor institutions are investing in this approach. And we're ready in June at the Board of Directors meeting. We'll be entertaining intervention strategies from each of the groups in housing, education, and health. So some of the highlights of 2018 is Weber State has got a new Office of Community Development. That opened in 2018. We were able to organize our 15-member Board of Directors. I probably can see that better without my glasses. 15-member Board of Directors, created rules and procedures. We received an award, which is always nice. The International Town and Gown Association began organizing a residential advisory council, which I think is really key. You know, sometimes we as bureaucrats or as agencies think we have all the answers. We know what best practices are, and that's important. But we need to figure out where the residents are and what they're ready for and what approaches might be effective with them. So we've got a residents advisory council that we're working with. We've got a number of different faith groups that are meeting with us, and we meet with them monthly and discuss how we can reach out to their memberships and what would work to help them as we develop these interventions. We, again, have created missions for each of these areas and strategies to focus on. And then one of the exciting things that many of you may have seen is that there is this new office that for the Community Education Center that Weber State has built on 26th and Monroe, and it is already really being utilized by the community. We have most of our meetings there. It's right there in the neighborhood, so that's been really helpful and exciting. So what we're looking at in 2019 are the following. 3 evidence-based interventions, so those will be presented to the Board of Directors in June, and we're excited about that. We're going to not recreate the wheel. We are going to leverage things that are already available out there and how we can work together to make sure that the information and those services are understood and taken advantage of by particularly this neighborhood. We have PIOs that are involved in our communication strategy. We want to really be able to tell the story of what this neighborhood, the history of this neighborhood, and some of the great things, so the public can be aware of what's happening and that people can feel good about that neighborhood as improvements are made in some of the areas. And then the Resident Advisory Council will be fully implemented, and we're well on our way now in 2019 since we're 5 months into it. We've got to find funding. This is not a sprint, this is a marathon. We're looking at a number of decades before you can really see a lot of these best practices and the fruits from those labors. We want to work with the businesses. There's a great opportunity, a supply of workforce here. How can we help get them ready to be of use to our businesses in the area? We've launched our website. We're excited about that. And opportunities for students to be involved. And that relationship with Weber State has been key. We've been able to have a lot of help that we wouldn't have otherwise. In fact, that website was developed by a master's student that took on that project and did just an awesome job of putting together not only a brochure but also doing our website. So there is progress that's being made, and we're excited about the future. And I mentioned these 3 areas, so healthy lifestyles, and really the goal there is that everyone has access to healthy foods and activities, and everyone maintains a healthy weight. Addiction, prevention, and recovery, the goal there is 0 opioid and substance abuse-related deaths. And then access to health care. Everyone has access to health care, a medical home, mental health, suicide prevention, and also make sure that women and children are getting that treatment as they need it. So just a thought.